think for me is a perfect example of how to partner between public health departments and nonprofit community-based organizations in order to really create an accelerated advanced model about how to engage.
We've been just working really well with our churches, our faith-based population, our county public health organizations, also our community-based organizations. We cannot do it without our community partners because they bring so much to the table, just sitting in meetings and just thinking outside of the box.
I think the most significant outcome of this funding that was provided to the LGBTQ collaborative in Orange County was that for the very first time in history, it really brought together all the organizations that serve the LGBTQ community.
In my experience, having this funding has been really giving us flexibility to create those crazy things that county or government they don't give. Having this unrestricted funding is gonna really supporting with other and enhancing with other county monies comes.
What I love about philanthropy and the Together Towards Health model is just the integration and the collaboration to work together. Also the support to do innovative things. Like sometimes when you're working and just with, like the government funding, you're kind of restricted to doing just, certain interventions all the time. And I believe that this type of platform really allows us to get creative and to really meet the needs of the individuals that need to be served.
The key buzzword a lot has been health inequities and just inequity in general. And like we said, the pandemic just put everything out in the open. And I think I see that as a challenge for the next 6 to 12 months when protections are going to run out and the money is going to stop.
We're trying to make this a health equity moment, moving from a moment to a movement. And all of our agencies, we know we existed because there's inequities in health, in finances, in education. That's why a lot of the CBOs and the foundations exist, is really to address that.
I feel like it's infrastructure that we have now that's going to create greater resiliency for our communities. And I'm really looking forward to the shift, not just in terms of what we continue to do around COVID, but how we take this model to respond to other entrenched issues that we've had in our community.